Microscopic urinalysis lecture. Introduction to urine microscopy, which is the examination of the urine sediment. It includes all solid materials that are normally suspended in urine. The solid material in urine specimens can be identified only by microscopic examination. Microscopic urinalysis is used to identify and quantitate formed elements within the urine. A microscopic exam may be included on all urines, or when we are looking for something that was positive on a chemical reagent strip. So methodology, we are testing the concentrated portion of the urine. It is a standardized procedure, and we use NCCLS guidelines, which include, in the exam, 10 to 12 milliliters of urine, a 5-minute centrifuge, approximately 20 uroliters of sediment is examined, and a standardized report format is used. So we need to pour into a tube 12 milliliters of well-mixed urine and then centrifuge for 5 minutes. And then we get the supernatant and the sediment. We would then decant off or pipette off the supernatant and leave the sediment in the bottom, which usually is about 1 milliliter. Since urine has a low refractive index or is light in color, an unstained sediment might be difficult to examine. So we use the Sternheimer-Malbin stain, which differentiates cellular elements, such as red blood cells from yeast. In urine microscopy, we use subdued light, fine focus, low magnification, meaning 10x, and then we go to high magnification, meaning 40x. We report as an average per field, and we correlate the results with physical and chemical findings. Some things that we will find in the urine sediment are cells, casts, microorganisms, and crystals. Sediment constitutes our red blood cells and white blood cells, which are typically abnormal in the urine sediment, epithelial cells, which can be normal. Casts, hyaline casts can be normal in small amounts, but cellular, granular, waxy, and broad casts are abnormal. Bacteria, there can be a small, minute amount of bacteria depending on the collection method, but typically high bacteria is abnormal. Yeast, Trichomonas vaginalis, sperm, mucus, crystals, meaning abnormal and normal, and artifacts can also be found in the sediment. Red blood cells, or RBCs, normal, there are 0 to 2 per HPF, meaning high power field, or 40x. If there is an abnormal amount, we call this hematuria. Red blood cells can be either crenated or swollen or ghost cells, and this is highly dependent on the specific gravity of the urine. Crenated cells are from hypertonic urine, meaning high specific gravity, and these red blood cells are hypotonic or low specific gravity, and these can be overinflated red blood cells. Here's a picture of what red blood cells look like. They are generally quite small, and as you can see, they are concave in shape and have a little indentation in the middle. And this is on a higher power field. On a lower power field, they will look completely flat. Here's another picture of red blood cells. Note the concaveness of the cell and the shape. And red blood cells can have various different shapes, but we oftentimes look for that concave shape. White blood cells, or WBCs we also call them, clinical significance is 0 to 2 leukocytes per high power field.